What I also love about our intersections is you working with the population here that may be without homes for so many years. So I would love your perspective on mental health in general. Like, specifically, like, where do you think we as a community could do better for them?
There's a lot we can do about that, and I think that the first thing I'm thinking about is kind of break down stigmas of it, right? And especially for everybody, right, that having a mental health condition is not a negative thing, and people shouldn't be scared. You know, I myself am an example for that. I mean, I spent many years of self-medicating to deal with some mental health concerns, and it was easier for me to say that, yeah, I have a problem drinking and using drugs, than to say is that I'm sad and lonely and I want to hurt myself, right? Like, that's not something that's easy to say, right? And so it's like easy for people to identify. It's like, oh, I saw Brian wasted at the bar last night. But did anybody ever ask me, like, how are you feeling? Like, what's going on? Why are you at the bar every night, right? And I think that's something else that needs to change, right? People automatically want to label something, what's wrong with you, without even trying to see what the actual problem is. And so making it a way for people to understand that, like, just because somebody's a drug addict doesn't mean they're just a drug addict, right? Like, what else is going on, right? And so, rethinking about how we help individuals who struggle with mental health and chemical use is definitely something that we need to think about.
Here's my wish. I really want us to be able to talk about mental health like we do cancer. We don't blame somebody for having cancer. We don't get mad at somebody for having cancer. Like, everybody rallies around. They do food trains and who can drive them to their treatments and all these beautiful things that we do for people with cancer or other illnesses that are physically related. And if we could start to be that way with other mental health situations, what that might do. If our society can start looking at somebody that's living on the street and getting curious about why might that person be there, rather than angry at them for loitering or making the streets unpleasant or whatever goes through people's heads. I think that could make such a big difference.